Well, there are a lot of people out there who are born with and display psychopathic behavior throughout their lives. That's what we're talking about today on Smart Life with Dr. Gina. But then there are others who start to feel odd, act odd, and think differently than they always have. And then they start to wonder, have I become a psychopath? Well, Dr. Melinda Silva, who is here with us today, has had a few patients come to her and say, Dr. Silva, what is wrong with me? Am I going psycho? Dr. Silva, welcome to Smart Life. It's so good to have you with us again. We've heard about these hormone imbalances affecting us in terrible ways. And you see patients, they come in and they really think they're going crazy. What's the first thing you do with that patient?
Well, I do a complete medical history because there's a lot of medications that can cause patients to feel out of whack.
Oh, right.
Yes, and then I look at their...
Even some antibiotics. I just want to add that because I didn't realize that. And recently my mother was on some antibiotics and we thought she was getting Alzheimer's.
Right.
And it turned out she went off the antibiotic completely fine and normal ever since, and that's been a year or more ago, so yeah.
And I look at their different lifestyle factors because sometimes stress or insomnia can make people go crazy.
Sure.
Poor sleep will ruin an otherwise good day.
Right. All the time.
So I look at their personal life, and then I always check their levels, their lab levels, including hormone levels, because that's my specialty is hormones.
Right. Okay. So we hear the word hormone, Dr. Silva, and my mind immediately goes to women.
Right.
Can this happen to men too?
Oh, most definitely. You've heard about the grumpy old man syndrome,
yes,
right?
Sure.
Well, that's low testosterone.
Right.
It's just with men, the decline is more gradual. In women, it's like when they lose their hormones, it's like falling off a cliff. So it brings them to the doctor sooner. But for men, it's a very slow process. And it's usually the wife or the partner saying, you got to go in and see somebody because they're driving the women crazy.
But I mean, the sad part is that probably then what most people tend to do is to go into their regular physician who's traditionally medically trained, and that physician might just put them on antidepressants or more chemicals that are just going to even mess with their brain even more.
Right. I mean,
is the kind of medicine that you practice a good first step, kind of trying to take a little bit more natural metabolic approach rather than just throwing chemicals at the problem all the time?
Well, I will tell you, I've been a doctor for 20 years, and I am licensed as a family doctor. So I'm a primary care doctor. So the benefit of seeing someone like me is that I bridge both, specialties.
Right.
The Western side of medicine and the Eastern side of medicine. So I like to take the best of both. And it's always good to have a good relationship with a primary care doctor. You should have a doctor that you trust, that you go through for preventive stuff.
Right.
Now, I see the patients that have seen their primary care doctors or who don't want to do mainstream medicine, and I'm happy to take care of them and evaluate them. I've treated men and women off of for depression and cured them just by balancing their hormones. So,
and then they don't have all those chemicals floating around their brain that do God knows what, right? I want to ask you, when you get the patient in, you do the evaluation, you find out it is that their hormones are out of whack, however they're out of whack, and you replace those hormones. What sorts of transformations can a patient expect if that really is the initial problem?
Oh, it's amazing. First of all, they're able to sleep better, they have better energy, their relationships in their lives are better. I mean, my husband says, if mama's not happy, nobody's happy.
So true.
So it really gives me great joy to treat women. So what happens is when they get their hormones balanced, they feel like themselves again. I'll have women that come to me that they say they don't feel like themselves. They could be snappy, they could be irritable, you could be less patient, you could be more anxious, you could be more depressed. Women who have hormonal changes, they don't have a traditional depression. They're irritated and depressed at the same time. They're angry and depressed, or they're anxious and depressed. All the moods are kind of mixed in. It's not a clear-cut anxiety and then depression.
But there are other symptoms too. There are physical manifestations.
Oh, most definitely.
That just then further complicate the already present emotional symptoms, correct? Tell us about some of those physical.
Like fatigue and chronic pain. I mean, I've treated both men and women who have been diagnosed with fibromyalgia and chronic pain syndrome. Patients that have arthralgias, joint pains, when their hormones are balanced, those pains subside and go away.
Wow, fascinating. So how are these administered? People are probably wondering, are these shots, are these pills? How do you usually administer hormones?
Well, I do the bioidentical hormones, and the ones that I use are made from plant,
made from
yam. So for women, it's usually a cream, a pill or injection or pellets. The only one that you could take as a pill is progesterone. The other hormones you cannot take in pill form because it can affect the liver. For men, the creams, the injections, and the pellets as well. The men don't do as well on creams because men don't like to put on creams, and it doesn't seem to help them as well as the injections or the pellets do.
And we talked a little bit about some of the improvements made for women once they go on the bioidentical hormones, but what are some of the things that men find once they've been treated?
Well, they have more stamina, they have endurance, they have less recovery time after the exercise. They have better memory. They're able to
That's both
focus,
genders, right?
Yes,
the focus and memory.
Focus and concentration.
And a lot of people
is
would
huge.
relate that to a hormone, but that can be a hormone issue.
The foggy brain that
Right.
men and women feel after 35 and 40, that can be a hormone imbalance. So when I see somebody, I always talk about quality of life indicators that may tell me that their hormones are affecting them, which are sleep, energy, mood, sex, stamina, and weight.
Wow, those are all huge issues.
Huge
issues. I mean, those are life issues. I mean,
Right.
just one of those factors is solved. For example, the weight issue, and all of a sudden, that alone is going to bring up your mood.
Right, it's going to put you in a bad mood if you gain weight, right? And
Exactly.
It's really important to do a complete medical exam and to figure out what's going on, because sometimes women and men need medication. So, you know, if you feel like you're suicidal or you're going to hurt yourself or hurt someone else, you have to be followed also with a psychiatrist just to make sure that you don't have a chemical imbalance, because not everything is going to be hormones. But you just want to find if it is a hormonal situation, then get the help that you need, because most people, I will tell you, do not have a Prozac deficiency.
Yeah, exactly. Quickly now, because we don't have a lot of time left, but I want you to, I hate to close on this, but if these things go untreated, what can happen?
Well, your quality in life diminishes. I mean, people will have issues with sleep, with sex, with energy, with mood.
I even read cancer.
Right, you can. The hormones, if they're not in balance, because one of the hormones that affect mood is cortisol. When you have increased stress, your cortisol is increased. When your cortisol is increased, the other hormones are not produced. The increase of cortisol makes you insulin deficient, makes you obese, makes you fat. That increase in obesity can increase your risk of cancer. So you can see how the hormones,
it all plays together.
They all are intertwined.
Where can we find you?
You can see me at drmelindasilva.com.
drmelindasilva.com. Thank you so much for being on the show, Dr. Silva.